identifying in a particular individual what is the root cause is important. That's the first step. What is autoimmune disease? It's a condition where the immune system is not functioning well. There's breakdown in something called tolerance. Tolerance is the ability of the immune system to recognize what is a self-antigen or which cell or which protein belongs to the human body itself. And it's trained not to attack the self-antigens. There's a breakdown in this process called breakdown of tolerance, which then leads to autoimmune disease. And traditionally, what we do is once autoimmune disease occur, we try to patch it all together by cutting down the inflammation, which is a downstream effect of breakdown of tolerance and the unleashing of autoimmunity. My approach, which I've been practicing for over a decade, is to try and identify the root cause of what's causing the breakdown in tolerance. And there's many candidates that we can go after here. A common one might be a chronic viral illness like Epstein-Barr, for example. That can lead to the immune system getting fooled into thinking that it's under attack and continuing an attack even though the original virus may have gone away. This process is well described in the autoimmune literature. However, it doesn't include every patient, of course. So identifying in a particular individual what is the root cause is important. That's the first step. Gut inflammation is another great source. Chronic inflammation of the gums might be another source, for example. And there's several other avenues for investigation. There could be a genetic issue also, for example. So really getting to that root cause first, and then understanding what we're dealing with in an individual patient, and then prescribing specific techniques that would help that individual patient is what our approach is all about. So it's beyond just treating a patient who's having a flare with steroids or other immunosuppressive drugs to understand what's causing the disease, what's fueling the disease, what are all these factors, be they psychological, be they environmental, like an exposure to a toxin, or be they genetics. We will deal with them at the individual level, and that's what's led to a lot of success in our practice so far.